Hi there, I'm Dr. Keller Wortham with another home edition of House Call, and today I want to talk about the hips, specifically pain in the hips, because I'd say after knees and low back, it's the most common musculoskeletal pain complaint that I get at my office. But hip pain can mean different things to different people, and sometimes what you think is your hip joint doesn't really have much to do with the actual joint at all. But listen in, because I'm going to clear up the different causes of hip pain and then show you some exercises you can do at home to help strengthen your hips, prevent some of the main causes of not only hip pain, but also hip arthritis. Okay, so let's start with some basic hip anatomy. The hip is what we call a ball and socket joint. You basically have this ball, which is our femur coming up here into the socket, which we call the acetabulum of our main hip joint, and that configuration gives us a huge range of motion in the leg. We can move it in all different directions, but it can put it at a little bit of vulnerability for certain movements. Then, in addition to the ball and the socket, we have a labrum, which is this little kind of gasket or cartilage ring that deepens the socket there. Then we've got articular cartilage, which is the smooth, soft coating on top of the bones to allow the bones to kind of glide on top of each other smoothly. And then we've got additional ligaments shown in pink here that kind of keep the bones together. And of course, your muscles and your tendons, the glutes, the hip flexors, the hip adductors and abductors. And then lastly, and important to mention, bursa. Bursa are little bags, basically fluid-filled bags that exist in different spots of the hip to help the tendons glide smoothly over bone or over other muscles. All right, so I have found that when people say they have hip pain, they can be talking about pain in their butt, in their low back, in their groin, even in their outer thigh. And it's important to identify the location because where they're describing the pain can help guide you on understanding the underlying problem and therefore the solution for it. All right, so let's talk about sources of pain. The main sources of pain in the hip can be muscle strains of like the hamstrings or hip flexors, tendinitis, which is inflammation of the tendons and where they attach, bursitis, which is inflammation of those little bags or bursa that I talked to you about. Then labral tears. Labrum is that gasket I mentioned that can kind of get basically ripped and can cause pain deep within the hip. And then of course, hip fractures, which is the big nightmare scenario that we want to avoid. I'll talk about more about that in another video. But this usually happens from a fall and can result in a shortening of the leg, a turned out appearance, and then the inability to bear weight. And the last one that I'm going to mention, and the one we're going to focus on today because it's the most common out there for my seniors, is hip osteoarthritis. All right? That is because of a loss of cartilage within the hip joint, that protective coating that helps keep the surface of the bone smooth so that they don't grind on each other. So how do you know if you have hip osteoarthritis? Well, the diagnosis is usually made by a physical exam, by the history, and then by taking x-rays. All right? X-rays, when they look, especially weight-bearing x-rays, can look to see how much of the space is left in that joint. The narrower the space, it means the less cartilage is left. And then sometimes you can start to see inflammatory elements there of the different bones. So, what do you do if you are diagnosed with hip osteoarthritis? Well, the first thing to do is, try to rest and get the hip to kind of deflame if it's in a flare-up. You can start with over-the-counter medications to be used short-term, like NSAIDs, like ibuprofen, or Tylenol. If the pain is more severe, you might need steroid injections that your orthopedic doctor can administer for you. And of course, if it gets very bad, you may eventually require a hip replacement. But before you get to all of these, we must stress the importance of exercise. Exercise is so important at preventing and reducing hip pain and also preventing and reducing hip osteoarthritis. So today, I'm going to show you 4 exercises for strengthening the hip and then 4 for stretching. Okay, so let's get started. Okay, so I'm here on the floor and I'm gonna show you 4 stretching exercises for the hip. These are important to help lubricate the joint. Lubricating the joint is so important because the hip is a synovial joint, and that helps get the fluid to move around. It helps promote blood flow to the joint and nutrients to help the cartilage that's there. So the first exercise is called a knee lift. I'm just gonna lie on my back. I'm gonna extend both feet straight, and now I'm gonna bring one knee into my chest. All I have to do is lie here and pull it in and pull it to my chest and hold it and get it kind of nice and tight in. This shouldn't be causing any pain. Hold it, hold it, hold it, maybe 15 seconds, and then go back down. And then we can do the same thing on the other side. Okay? That's just a simple knee lift in to help stretch the hip. The second hip exercise, we're gonna sit with the soles of our feet together. This helps with the external hip rotation. And some people call these butterflies, and all you do, you put the soles of your feet together, you hold here, and then you just have to lean forward until you feel the stretch. You don't wanna kind of arch over like that. You wanna kind of keep your chest forward so you don't put any strain on your low back. You can pull on your feet a little bit to create a gentle traction. And then if you want to kind of flap the wings there of the butterfly up and down a little bit, you can. Again, you're just leaning forward to feel a nice, gentle stretch in the inner groin here, okay? Like most stretches, you can just kind of hold that for about 30 seconds and then relax out of it. Okay, the next exercise I'm going to show you is what I call a double hip rotation. So you're going to start with your feet flat on the floor, and we're just going to let our hips go from side to side, the knees together. We're gonna let them kind of drop over to one side. I'm gonna feel a nice stretch in my low back across the buttock. And then I'm gonna let them drop to the other side. Again, hold there. So with these, you can of course hold on either side for about 15 seconds, or you can kind of move back and forth slowly like I'm doing. You just wanna feel the muscles along the sides of your butt and your abdominal area stretch. And then the last exercise I'm going to show you is just a gentle low back stretch. And that's basically just pulling now both knees into your chest and holding there. Okay? You can squeeze here if you'd like. You can also bring your head up to your knees like this. And that's very important for stretching out the muscles of the buttock and the low back to keep the hips in better alignment. Okay, so we did our 4 stretching exercises. Now we're just going to do 4 strengthening. The first is just a standard hip flexion. Basically, you're just going to stand here, stand straight. You can use a chair if you need to. And then I'm going to demonstrate this forward. It'll be easier for you guys to see. And you're just going to raise your knee up to your chest. Okay? Raise your knee up to your chest. You can use your hand to hold it. There you go. And you just repeat that exercise maybe 10 times, a good strengthening motion here, and you can do that on each side, okay? Second exercise I'm going to show you is a hip extension, holding the chair here for balance if you need it, and then it's just slowly extending the leg behind you. Again, you're doing sets of 10, maybe holding for 3 seconds and letting it come back. I like to do 10 on one side before I alternate to the other, so you're getting a good muscle workout before we switch to the other side. We've got hip abduction to the side. This is basically where you're gonna use this chair again for balance, and we're just going out to the side this way. All right, we're gonna do a set of 10, holding for 3 seconds, coming back down. 1, 2, 3, and back down. I wanna keep the toes pointing forward, coming back down, and of course I'll do the other side. And then the last exercise is just a heel to buttock raise. So this is basically kind of here, and you're just gonna raise the heel up to your butt as close as you can get it and come back down, up to your butt, hold it and come back down. And of course you'll do 10 on one side and then switch to 10 on the other side. All right, so there you go. Whether you have pain or not, whether you're headed to surgery or aren't, doing hip exercises to stretch and strengthen this incredible joint, you'll be doing yourself a big favor. You'll be helping protect your hips, help prevent the worsening of arthritis that leads to the need for a hip replacement. So implement these exercises at least a couple of times a week, all right? Thanks for tuning in. I'm Dr. Keller Wortham, and I'll be back soon with another home edition of House Call.